Unhappy after explant surgery? What can you do? Well, this patient had prior explant surgery and fat transfer with a breast lift. It was a large implant, and as the pocket collapsed, she developed significant deformity. A second stage surgery with scar revision and fat transfer really helped, where the scars were tightened, excised, and a second round of fat transfer was utilized to fat graft the breast. This created a much better shape and really improved this deformity. Here's another patient who had prior explant and lift and ended up with an indentation, which can sometimes be seen when the implant is placed medially and is trying to build up cleavage. So as that pocket collapses, sometimes an indentation in this area can happen, and it's not uncommon with explant surgery. A year later, we did a fat transfer and harvested fat from multiple areas in the trunk and grafted the breast, and you can see a much significant improvement after a second stage fat transfer to the breast. In this patient, who had prior problems with breast fold malposition when her larger implants were creating a bottom out deformity. When the pocket collapses, it tends to pull the breast fold higher, and it can be hard to anticipate during the initial explant surgery, even with a breast lift, where the breast fold is going to be. So sometimes scars can fall out of the breast fold and require a revision surgery of the scars, which this patient had. And this patient also was a very good liposuction and fat transfer candidate. So she had second stage fat transfer. Here you can see her early post-op, and here you can see her long-term post-op. Some fat is lost, but it really helps with the shape, and it helps improve deformity after prior explant surgery. Patients who are really thin can be more difficult to harvest fat for fat transfer, but more and more we're seeing patients with thin body habitus and athletic build that end up doing really good after fat transfer with explant surgery. See your board-certified plastic surgeon for more details on explant surgery in general and any problems you may have after.